This time it gives me great honor to introduce to you our keynote speaker, Mrs. Sherlonda Adkins. Mrs. Adkins received her Master's of Science in Physician Assistant Studies from the Medical University of South Carolina, is nationally certified by the National Commission on Certification for Physician Assistants, and is licensed through the South Carolina Board of Medical Examiners. She has a Master's in Public Administration, a joint program through which the University of Charleston and the University of South Carolina. Ms. Adkins is currently enrolled in the doctoral medical science program at Rocky Mountain University and graduates tomorrow. Congratulations. Over the past 7 years, Ms. Adkins has worked in a private outpatient psychiatric practice treating a variety of mental health disorders, including generalized anxiety, bipolar, major depression, binge eating, ADHD, and PTSD. She also worked in a busy internal medicine practice, treating a variety of chronic and acute medical conditions. With recent changes in the South Carolina PA Practice Act, Ms. Adkins was able to start her own telepsychiatry practice in January of 2020, just in time for the global pandemic. Ms. Adkins is committed to training the next generation of PAs, as evidenced by her starting the Black PAs of South Carolina's group in 2020. Ms. Adkins is married to her college sweetheart and has 3 children. One who will be graduating from MUSC's College of Pharmacy next year, and one who will start Carnegie Mellon University this month. Her hobbies include listening to music, amateur photography, and travel for missions and pleasure. Please join me in welcoming Mrs. Sherlonda Adkins.
Good afternoon, everybody, and thank you so much, Dr. Martin, for that wonderful introduction. I am very grateful for the opportunity to stand before all of you today. 7 years ago when I graduated, I would have never thought I would be back speaking to you, standing here to give you a few words of encouragement. And I can relate to you as a student, not just because I was a PA student from MUSC just like you, but for those of you who are non-traditional students, for those of you who are minority students, for those of you who are mommy students, for those of you who are married students, that was me sitting right in your place. I can also relate to the parents because, as mentioned, I am a parent of a graduate student, and I understand the amount of support that's needed to help our adult children when they're weathering the storms of a rigorous graduate program like PA school. So today, I don't stand here before you today as an expert in anything other than my own personal journey, and even some days I question my expertise in that. But I do know the general road that you all have ahead of you, and so it is my challenge to myself in the next few minutes to try to provide you some words of, should I say comfort? Would that be too scary? We'll just say encouragement, how about that? So on this long-awaited day, my simple advice is to cultivate a spirit of courage. So what do I mean by that? Well, obviously, each one of you had the minimum amount of courage to even apply to the program. And I know some of you probably said, why wouldn't they want me in their program? You had that much confidence. And then there were some of you who just closed your eyes and said, I'm gonna shoot my shot and see where it lands. But regardless, you made it, you're here right now. When I graduated in 2014, I remember thinking I was one of the few because 10 years ago when I got ready to apply to PA school, I was told that there would be over 700 applicants for 63 spots. And I don't know what the numbers are now, but I'm sure it's still pretty competitive, so you should be super proud. You knew what the stats were, and you still did it anyway. So why do I say that you're going to need courage? You're going to need courage so that you're not afraid to try a lot of different things. Because number one, if you're lucky, you'll land your ideal job right after graduation. And if you're lucky, you'll hate your first job right after graduation. So either way, you win. Well, why do I say you win even if you don't like your job? Because it's given you an opportunity to try on different garments and see what you like and what you don't like. And as you're doing that, you are constructing a customized version of what the best fit is for you. It's like trying on clothes, and you are fortunate enough to have a personal tailor, you're probably going to department stores and trying on suits and trying on dresses that were made for the dimensions of the general population. And you may have to try on several different garments in order to find the one that fits you. Sometimes, you know how it is, especially ladies. I have to be a little biased here, but ladies, you know when we go and try on something, it might fit good right up here, but then right here it's kind of gathering in a weird way. Well, that's how it is the same when your career path. And then you might think, you know what? I know the solution. I'll just take it up a notch. I'll get better quality. I'll go over to Rodeo Drive, cardiothoracic surgery, or Versace, dermatology, because we've all heard that those are the careers that you need to have. And you know, you can go and try it, but you may find out that those still don't fit. And if that's the case, keep moving, because guess what? You're in the process of creating that custom fit for yourself. And the beautiful thing about it is all of these experiences, they don't go to waste. They become your accessories. Like that nice watch or a bracelet, cufflinks or a necklace, the ones that make the outfit pop. If you commit to learning, regardless of where you are setting yourself up to be a force in the world of healthcare. One of the sweet advantages of being part of the healthcare team as a PA is that we have the unique ability to make lateral moves, even in a completely different direction. I was in a recent meeting with the president of NCCPA, and I was shocked but proud to hear her say that the number of PAs who have worked in more than one specialty is now over 70%. Did y'all get that? So for those of you who are concerned because you still haven't figured out your niche or where you want to be, I would encourage you to take a look back, look over your life, look for the golden thread that has been interwoven in your life for as far back as you can remember, because that will likely point you to your passion. And when you pay attention to your passion, you can integrate that into your life. You can integrate that even in your profession. And at that point, even the sky isn't the limit. I have PA colleagues who perform on stages, who have written books, who have taken on non-traditional roles like medical science liaisons and clinical directors. And don't be surprised, just when you think you have it all figured out and that outfit is looking nice, that it's not fitting as well as it used to. Maybe you've gained a little extra weight, meaning that you've gained more knowledge and skills, and maybe you need to be challenged more, or perhaps you're in a different season of life where the temperature has changed. It's a little bit cooler or it's a little bit hotter, as in your lifestyle or your family needs, or even geographical changes may come up. There have been a variety of partnerships, contracts, affiliations, arrangements that I've tried on over the past 7 years, and some of them were a great fit and some not so much. It would be nice and sweet if I would stand here and tell you that I set specific goals, followed them to a T, and everything just worked out. But it didn't happen that way. In fact, during my 85. So I was curious about all possibilities. I wasn't one of the students who came in and said, I know exactly what it is that I want to do. I was open. And from graduation to now, I've worked in 2 areas of medicine, psychiatry and internal medicine. And I didn't know that I would go on to become one of the less than 2% of PAs working in the field of psychiatry during the time where there is a nationwide shortage of psychiatrists. I didn't know that I would be an entrepreneurial PA. Starting a practice would open doors for me as a speaker, a consultant, as a preceptor. So basically, I'm a unicorn PA. I recently read an article that was on LinkedIn, and they asked more than 1 million followers if they could go back and talk to the younger version of themselves, what exactly would they say? And although the advice varied, there was one common message that was conveyed in different ways. And it wasn't the cliche things like, oh, believe in yourself and don't procrastinate. It was simply try on as many different experiences as you can. Aggressively explore all options that seem interesting. Learn, iterate, and you'll arrive at that perfect path much faster. Continue testing, make mistakes, keep learning, and don't be afraid to explore. Focus on action, experimentation, and course correction instead of trying to pre-plan and have such rigid goals. Second reason that you're going to need a lot of courage is because you all will be change agents. At some point, you may encounter tough situations at work. It could be discrimination, it could be inappropriate behavior, or even just ineffective policies. But you're in a position to use your voice and speak up. Advocacy is more than just trying to tell people over and over again that you shouldn't have apostrophe S after the word physician, because we are not physicians' assistants, right? It's more than explaining to patients what a PA does. It is about knowing your skill set, knowing your knowledge, and making sure that you are being utilized in a way that's not being diminished by someone else's fear, ego, or ignorance. Don't be deceived into thinking that you have to wait until you get established to make a difference. You are trained to diagnose problems and formulate solutions, and that extends beyond the human body. You may find yourself working where your presence in the organization is paving the way for other PAs behind you in your organization or even in your state. So don't wait until you have time or until you have things figured out to get involved in leadership, especially your local leadership. And lastly, you need courage to face yourself. Now, this is what you get when you have a keynote speaker who spends her days talking to patients about mental health. You need to face yourself. Don't chase the elusive goal of happiness. Happiness cannot be bought. It's gonna feel real good to get that first paycheck. And for some of you, it's gonna be the largest check you have seen in your life so far. But don't get into the mindset of thinking that that's gonna buy you happiness. You'll have the opportunity to purchase all sorts of wonderful things to make yourself feel happy. However, at the end of the day, 3 cars in the driveway, a 7-bedroom micro mansion with an in-ground pool inside, and lavish vacations won't bring you internal joy and peace. The temptation to acquire can distract you from the uncomfortable but necessary process of sitting with yourself and pursuing inner peace. However, for the pandemic, for many of us, the pandemic made this a common pastime because a lot of our distractions were taken away. So I highly encourage counseling for all caregivers, so PAs, all of your, I'm not gonna go into all of that, but for obvious reasons, you're taking care of other people, but make sure you're taking care of yourself. At the least, be a part of a network of other healthcare providers so that you can have emotional support during this journey, because it's not all peaches and cream. All right, so that's the main part of what I wanted to tell you. Now, I have a little gift for each one of you graduates. I reached out to a group of almost 8,000 PAs. I told them I was gonna be here today speaking to you, and I asked them to give me some words of advice coming from them, because, you know, just my mindset, I'm a little limited, but I wanted to hear from everybody else. And so there were lots of things, a plethora, hundreds of comments. So I tried to condense them and summarize them, and this is what they told me to tell you. They said to stay humble. You are not better than anyone else on the healthcare team. And one PA said that she's worked 20 years as a PA, and she's managed over 45 PAs, and with the common graduates, she's seen that some of them have wanted to have things handed to them or seem to think they're above others. But be kind to everyone in the office. That's the lab techs, the CNAs, MAs, custodians. You're there to serve. It's not about ego. use your powers for good, continue to learn and be confident in your care for patients, know what you don't know. Don't be afraid to say you don't know. Ask questions because someone's life and health are on the line. Your graduation doesn't make you the expert, it makes you the expert on learning medicine. Always do your best to take care of the patient, even the difficult ones. Do no harm, treat them as if they were your family, because every patient is somebody's mother, father, son, or daughter. Always do the right thing. Treat everybody with dignity and respect, the same that you would want to be given. And also remember that we all carry hidden burdens, and that grace and a few kind words can sometimes melt a hard heart. Take time off. Take time to reconnect with the people and the elements in your life that will restore your soul. The job you're on now will not be your last job. And lastly, set boundaries with your patients and coworkers. So those were the ones that topped the list. I figured that's all really good advice, but there were a couple of ones I just couldn't resist from including them. This one's so profound. This person said, don't go chasing waterfalls. Stick to the rivers and the lakes that you're used to. And the tears decrease in frequency, but laminating your notes may still be necessary. The mission of the MUSC PA program is to graduate highly competent physician assistants who are compassionate, culturally aware, and attuned to the primary healthcare needs of the people of South Carolina and beyond. They will be prepared to provide quality, evidence-based, patient-centered healthcare as integral members of interdisciplinary healthcare teams, advocate for the physician assistant profession, and meet the healthcare needs of the larger community through education, research, and service. That mission has been accomplished. It's time for you to transition from your individual journeys that started with getting the PA school prereqs, patient care experience, endless studying, OSCEs, exams galore. This is your moment. And my hope is that each of you will have a great transition into your role as a practicing PA. Use your knowledge, your energy, and now your influence as superpowers to do much good in our world. Go out there, try on as many outfits as you can, whatever you need in order to make sure that you find your fit. There used to be a time when simply graduating from PA school by itself meant that you were next to invincible, extremely resilient, and of course, brilliant. But graduating from PA school during a pandemic, during political unrest and social injustices, that means that you all are the GOATs. And now you are commissioned to go out into the world and serve as superheroes. Congratulations to each one of you, my new colleagues.
Sherlonda, on behalf of the Division of Physician Assistant Studies Program, the College of Health Professions, we'd like to present this small gesture in appreciation for your keynote speaker address, and we really appreciate it, and thank you so much.
Thank you.